My name is Iryna Kerr, and I am a chairwoman of Dumfries and Galloway Multicultural Association. Our members, our minority members, have a lot of questions and concern about COVID-19 vaccination, risk of COVID-19, and side effects of vaccination. We decided to make this short movie to be able to answer all these questions. We have a great support of NHS Dumfries and Galloway and working in a close partnership with NHS Dumfries and Galloway.
Hi, I'm Nigel Calvert. I'm one of the public health doctors at the Health Board, Immunisation Coordinator, and I'm here today to try and answer some of your questions about coronavirus vaccination.
Hello, my name's Julian Hyde Chambers. My question today is, how does the vaccine work?
Well, thanks, Julian. That's a really good question. Vaccines work basically by tricking the immune system into thinking that they've seen the bug, in this case a virus, before, so that it's kind of primed, so that when you're confronted with the actual virus, you're kind of ready for it and you can produce antibodies much more quickly.
السلام عليكم. عزة البشير. هل يؤثر لقاح كوفيد على الخصوبة أو الحمل? Hi, my name is Azza al-Bashir. Does the COVID vaccine affect fertility or pregnancy?
Thanks, Azza. Really important question. Absolutely not. There's no evidence at all that it's going to reduce your chances of becoming pregnant, and it's safe for pregnant women to take the vaccine. In fact, we really want pregnant women to take it because pregnancy itself can increase the risks from catching COVID. So these are exactly the kind of folks that we want to be protected.
ما مقدار الحماية التي يمنحها اللقاح لفرد أصيب بالكوفيد? How much protection does the vaccination give an individual who has previously contracted COVID?
If you've had COVID in the past, it's very likely, I mean, it's a new disease, so we don't really know, but it's very likely that you're going to be immune for some months or even years afterwards. The vaccines are going to be at least as effective in people who've had COVID as people who haven't. So we would expect 2 doses to give, very high protection levels, so 70, 80, 90%.
هل وجود الأجسام المضادة للفرد المصاب بفيروس كورونا يعني أنه محصن ضد كوفيد؟ شكرا. Does the presence of antibodies for an individual who had COVID means that this individual is COVID immune?
It's a really good question. I mean, we don't routinely test for antibodies. It's more of a research test. It can be done, but the tests which people are taking now through the NHS look for the virus rather than antibodies. But if we were to test somebody's blood for antibodies and they do have antibodies to COVID, then yes, they're immune.
你们好，我是曾燕大夫。我现在呢，就是说很多人都比较担心这个注射这个新冠疫苗的对这个心脏和这个血液粘稠度比较高的这些人哈，我是比较担心这方面会引起这个心脏的阻塞和这个脑梗塞，和这个血液的比较粘稠的这个情况，其他的情况我认为是还是可以。Thank you， 谢谢。I just a little bit worried is who had this medical condition such as heart problem and high blood vesicle set and high blood pressure. This is I worry about that.
I think for people who have heart conditions or high blood pressure, these are exactly the people who we do want to be vaccinated. We've seen that COVID infection can be worse in people with pre-existing conditions, a little bit like with the flu vaccine that we're very familiar with. So these are exactly the people who we do want to reach.
Mam na imię Monika Momot i chciałabym się wypowiedzieć na temat szczepionek i co mnie martwi w związku z tymi szczepieniami. Martwię się o alergię i skutki uboczne szczepionki. I worry about allergies and side effects to vaccine.
You're quite right to be concerned about allergies. With any medicine, we take this very, very seriously. People will be asked before they have the vaccine what their history of allergies is. In fact, there are very few people who can't take the coronavirus vaccines, there are one or two very specific compounds and chemicals which people are allergic to, which would mean they couldn't have the vaccine. But these are all very, very carefully screened for. And there would be the opportunity to use a different brand of vaccine, if it was thought that that was going to be more appropriate.
Martwię się także o jak długo pozostaje szczepionka w organizmie po szczepieniu. Second, what I worries is how long does the vaccine last in the body.
So that's a very good point about how long the vaccine lasts. The vaccines which contain this mRNA, this messenger RNA, which kind of causes your own cells to produce the spike proteins, which the virus would, and then that's what we recognise. The mRNA only stays in the body for a matter of hours, but the immunological memory lasts for some months. We don't really know yet. I mean, we're still in the early days, really, of this pandemic, and we're quite likely to need boosters. But it's going to provide protection for months, if not years. And then we may need to have boosters, every year perhaps, as the years roll by, but we'll need to see how that goes.
Hello, my name is Greg Moore. I'm from England, and I was wondering, with all these new variants of COVID-19 around, how can we be sure that the vaccine will be effective percentage-wise against all these new variants?
Thanks, Greg, a fellow Englishman. Yeah, very, very good point. These things are all monitored very, very carefully. This Delta variant, which we hear so much about over the last couple of weeks, does seem to be a bit more resistant to the vaccine. Although with 2 doses, it looks as though the vaccines are almost as good. But this is something we really do need to keep a very close eye on. The beauty of these new mRNA vaccines, which have been produced, are that they are quite easy to actually adjust. So we may well need to have boosters, as time goes on, so that we can actually be protected against all the different variants which are likely to occur. But yeah, you make a really good point.
Lorna Argenti, Dumfries resident. Why is it that so many ethnic minority people are reluctant to take the vaccine?
Very good point, Lorna. It's something we're very aware of here in Dumfries and Galloway. We always try and provide information in an accessible format for people so they can make the right decisions. I think some groups of people tend to rely on social media a bit more. I know there's some WhatsApp messages going around which are proving fairly unhelpful and giving inaccurate information. So there's loads of good information on NHS Inform, which is in a variety of languages, and we're always happy to try and address any specific concerns that people would have.
There seems to be an issue with certain minority women with regard to privacy. They do not feel that they will have access to the privacy that they need in order to take the vaccine.
Again, a very good point. The venues for vaccination are chosen very carefully, so there always will be private areas where people can discuss anything they want to talk about, and obviously the vaccine will be given in private as well. You mentioned women in particular, and it's probably worth mentioning that most of the immunisation team are actually female anyway, so we can always make sure that if a woman wants to be vaccinated by a woman, then I'm sure that can be arranged.
Personally, I think the media is causing panic to people who haven't taken the vaccine. They are trustable media houses with social media pages, and they will be posting people who died or after taking the vaccine, and people who had blood clots, and the vaccines that have been stopped because of issues of blood clots and everything. So in as much as someone is willing to take the vaccine, but you cannot ignore such, like you ask yourself, will I be the next person to die? Or you feel like you're hesitating to take the vaccine. So I think they are causing unnecessary worries and panic to people.
Thanks, that's a really important point. Obviously, it's a worrying thing, these reports that we see in the media. But I would encourage people, to bear in mind that the risks and probabilities. With the AstraZeneca vaccine, there's roughly 1 in 250,000 people who receive the first dose will have a clot. We think it's of that order. And the death rate would be equivalent to about 1 in a million. So it's about 1 in a million chance of dying from having the vaccine. But of course, the chances of dying from coronavirus infection itself are much, much higher than that. So I think it's really important to try and keep things in perspective, but it is very difficult with some of the media stories which are circulating. Absolutely agree with you.
I hope in this short movie we answered all your questions and satisfy all your concern. Also help you to overcome your language barrier, mentality barrier, and it's always better when somebody with familiar face answering all these questions.